check and everything else, so I hope not too many people are held up and you've had time to get your breakfast. And we're going to kick off with this morning's first press briefing before the main event starts in the hall. And it's my great pleasure to welcome Conrad Clifford, who's our Deputy Director General. And we're going to talk to you a little bit today about the lessons we can be drawn from the pandemic that we've seen over the last couple of years, because these issues are probably not going to go away in the longer term, so it's good to understand what's been going on. We think there are some lessons that can be drawn. So we're going to talk briefly about that, and then obviously we'll take questions. Okay. Thank you, Conrad.
Thanks very much, Chris. Good morning, everybody, and thank you very much for coming. As Chris said, I'm going to give you a short presentation to look at the lessons we think should be learned from the pandemic. The effects of the COVID pandemic, as you know, are still not yet over. But as the pandemic recedes and aviation is on a recovery path, it's a good opportunity to reflect on the lessons of the last 2 years. When COVID-19 emerged, the WHO were clear that border restrictions were not the right approach. And World Health Organization Director General Tedros Ghebreyesus said there's no reason for measures that unnecessarily interfere with international travel and trade. We call on all countries to implement decisions that are evidence-based and consistent. But of course, unfortunately, governments didn't listen to the WHO, and this map shows the border restrictions in force at the end of March 2020. Some 93% of the world's population were impacted by restrictions. And this pattern continued for almost the following 2 years. Even in January of this year, some 100,000 different measures affecting international travel were in place. And the result was a devastating economic blow, not just to the millions directly employed by aviation, but to the millions more in aviation-supported industries, such as tourism, and of course to wider supply chains and other business sectors that rely on the swift movement of people and goods across borders. So we must never again find ourselves in a situation where borders are closed by governments in the face of all advice and all the prevailing evidence, and lessons must be learned. Lesson number 1, the evidence shows that border measures are not an effective global strategy to control COVID. And the WHO's advice that I referred to earlier was not to close borders, and that came from experience. But this was backed by new evidence that emerged during the pandemic. And research from Oxera and Edge Health during the emergence of the Omicron variant revealed the futility of border restrictions. In the case of a new variant being discovered and border restrictions being implemented immediately, this delayed the peak of infections by just 4 days. And in the far more likely case that border restrictions would come in, say, a week after a new variant was discovered, this would delay the peak by just 2 days, and in some cases it would make no difference at all. So there's very little justification for continuing with border restrictions at this point. The virus is endemic, and efforts should be focused on domestic measures to protect and to care for the most vulnerable. Lesson number 2, governments should balance health measures with economic and social impacts. The evidence for border restrictions is shaky. The evidence for the economic and social benefits of air connectivity is incontrovertible. Politicians, therefore, cannot ignore these benefits when weighing up the need for health-related travel restrictions. In 2019, aviation supported nearly 90 million jobs and $3.5 trillion in GDP. 2019. By the end of 2021, those supported jobs, 90 million in 2019, were down to 44 million in 2021. I already touched on the huge social damage that was caused, and many of these impacts may not be completely understood for years. But interestingly, the public instinctively understands. And throughout the pandemic, we've been polling travellers to hear their opinions on travel, on COVID, on the environment, and other matters. An incredible 92% of those polled agree either strongly or somewhat that air connectivity is critical for the economy. And professional pollsters will tell you that getting the public to agree 92% on anything these days is quite extraordinary. So politicians would do well to understand better the economic importance of keeping travel and transport open. And that would lead to a more flexible and nuanced approach to border restrictions. But we're really keen that governments don't just take our word or the opinions of the public or the economic facts into account. And so we would very strongly support independent research into this. What we need is strong evidence on the importance of balancing health measures with the social and economic benefits of air connectivity, with a view to agreeing a set of global recommendations for handling future health crises. Although most major restrictions, such as total closures and quarantines, have been removed, and the world is increasingly open, thankfully, governments are still making travel unnecessarily difficult. Restrictions such as complicated paperwork, COVID testing, mask wearing are still commonplace for travel, despite these requirements having been lifted in domestic life. And our analysis of the top 50 passenger markets, which comprise 89% of 2019 global demand, shows that 16 of those states still impose significant entry restrictions and or quarantine measures. So the third and final lesson for governments is that traveller confidence requires logical rules and clear communication. We're seeing an uneven and poorly coordinated recovery from COVID, and that's partly because of the border restrictions and travel rules that I mentioned earlier. But it's also because of the illogical stop-start, flip-flop nature of these rules that have been in place throughout the pandemic. Frankly, public confidence has been damaged by the arbitrary rules and by poor or contradictory information. I already mentioned that 100,000 different measures were in place at the start of this year, and it's no surprise that navigating this fragmented system has been confusing and has caused major operational complexities for carriers. Our passenger survey shows why it's important that governments adopt a consistent approach to travel rules. 59% of people still report that understanding the rules was a real challenge. 57% that paperwork was a challenge to arrange. 56% that the travel experience was much less convenient. And you all came here from all around the world, and I'm sure you've all experienced what a nightmare it is in terms of paperwork complexity, trying to understand the rules, knowing what you're supposed to do. So how can governments generate greater confidence in the predictability of travel? We would suggest that they adopt guidance for how public health measures, once introduced, will be scaled back or removed. Sunset clauses, as we call them, would generate an automatic review process. And if additional travel bureaucracy and paperwork is required, focus on digitizing it and making it as simple as possible, and agree common standards and mutually recognize similar systems in other states, because all of this would help to speed up adoption and understanding. So we set out 3 lessons that we believe will help to guide governments when the next health crisis emerges. One concrete action that could begin at once is for independent research to be undertaken into the effectiveness of policies which balance health measures with the social and economic benefits of air connectivity, with a view to agreeing a set of global guidelines and recommendations for handling future health crises. As the world emerges from COVID and remaining travel restrictions are removed, and hopefully that's very soon, we will return to a situation where our greatest concerns will focus on the sustainable growth of global connectivity. But that cannot mean that we forget the lessons that we've learned impact of what a world closed to travel was like. It is likely there will be more global health threats. Applying these lessons to future crises is the best way to ensure that the sacrifices made by millions of people were not made in vain. Thank you very much, everybody. And questions?
Yes, thank you very much, Conrad. So we'll go straight to questions. Does anyone have any hands up? Yes, I'll start at the front. Thank you.
Hello, AGM. Conrad, we have this year the IATA assembly, and you know the lessons learned are important, but you know sometimes I completely agree with you. Governments that don't listen, in a way. Then how you can pass the message? We have the assembly, and then we have all the governments all together next September.
Yeah, thanks very much, Joss. It's a very good question. So at this 41st Assembly, which is September, October, we're putting a paper in precisely on this topic to say that governments should undertake independent research. Actually, for ICAO, there's a broader medical picture in terms of how they're actually set up to deal with public health crises. So we're making recommendations for how they can approach future health crises in the actual organisation of ICAO. We're also asking them to undertake independent research into the pandemic that we've experienced over the last 2 years. The challenge with this particular research would be that it has to be independent. So whether ICAO would be the right body to undertake that, I'm not sure. It could be a UN task, but it certainly needs an independent body.
Yes, over there. Thank you.
Now from Ginsberg, Business Travel News, London. I mean, we just touched on this ICAO thing and getting everybody to agree. My understanding is ICAO is a division of the United Nations. At the end of the day, it's the United Nations that's got to have the common rules. So that the point I'm making, I'm sure you may or may not agree, that it's ICAO that this is going to be done for. As much as we like IATA, we are an association of not all the world's airlines, so that's just my point.
Yeah, you're right. It can't be us. For IATA, we can't do this research. It has to be something that's done independently.
Thank you, Malcolm. Yes, thank you, Bruno.
Bruno Trevedic, Les Echos, Paris. So you say that there are more than 100 restrictions still in vigor around the world. Could you detail how many airlines, for example, IATA Airlines, are still asking for passengers to wear masks abroad? What percentage of international destinations are still closed? Things like that.
So how many airlines are currently requiring masks? Yeah, I don't have that exact detail.
Yeah, we don't have that, but I'll just bring up that slide again. I mean, we can talk a bit to how some of these countries, why we categorise them in that way, if that would be helpful. When Conrad, do you want to?
Yeah, I think we've got detail on countries that require mask wearing for international travel, so we can provide that data. It would take some time to get a number for airlines.
Yeah, I think the key point about this map is that those countries that are listed as still requiring significant entry restrictions, that may refer to people who are unvaccinated as well, because we regard fully open countries as ones that will allow unvaccinated customers access as well.
And one thing with mask wearing that's really important is that in a number of countries, mask wearing has been removed domestically, and yet it's still applied to international travel. So again, we're really pushing governments. If they've removed something domestically, then they should remove that same requirement internationally as well.
Yes, please. Thank you.
Good morning, Grisha Schumann, Aerosite. You have been, as IATA, pushing this month after month, presentation after presentation. Where has your lobby filled? Because countries have done differently.
It's, I think, to be frank, the problem is that governments don't view this as a health issue so much as a political issue. So a lot of political factors come into play when you're talking about this kind of circumstance. So the evidence would be there for saying that the borders should not have been closed, but it's a populist thing to do in some countries. So even though the evidence may not support it, politically it might be expedient. And that's been one of the big problems with the entire outbreak, trying to concentrate on the science and not the politics. And politicians are political, so that's been a challenge.
I think another factor as well we found as a challenge, I think, Conrad, was we have not historically had to engage with health departments, so we were used to dealing with transport departments, and that became a real challenge for the industry.
Yeah, and that's a very good point, and that was one of the issues for IATA as well, that IATA is comprised of civil aviation authorities and the regulators of aviation and transport, and they hadn't really had detailed discussions of this nature before with health officials, so that presented quite a challenge at the beginning, trying to get onto the same understanding of situations and problems, and the same approach to risk as well.
Yes, thank you.
Eric read newspaper in Belgium. And the problem with pandemic is the way they spread. This time was with breathing. Next time, maybe touching or fluid or who knows. So how can you anticipate this this problem?
So the method of transmission, I'm not sure that I'm not sure the method of transmission is really the issue. I think the transmissibility is the issue. So what the AGM health studies were showing is that as politicians were closing borders, because of the transmissibility and the infectiousness of Omicron, the virus was already in their country. So it was already too late. So I'm not sure that the method of transmission is such a big deal, but it's the transmissibility of the virus and the fact that when it's already endemic and already in your community, then closing borders doesn't really, it's not effective.
And one of the things that our polling has shown is that people responded to the extra efforts that carriers were making in terms of wiping down the seats and the extra kind of sanitary measures that were put in. Those were definitely helped public confidence. So I'm sure those lessons will be looked at as well. Thank you. Any other questions? Oh yes, sorry, Constantine.
Hi, morning. We are seeing a lot of manpower crunch with all the airlines and across the world right now. So what lessons could we have learned from this pandemic in terms of manpower management while balancing the profits and losses for airlines?
That's a very interesting question. And actually, manpower crunch and really we're seeing a very mixed bag of experiences. So some airports, some locations, some countries, it's noteworthy that where governments have provided wage subsidies to keep people in work, airlines and airports have found it far easier to get back to sort of full capacity again because they've been able to retain those staff through the pandemic. So I think a lesson learned would be that actually encouraging and incentivizing the industry to retain the employment of those essential manpower is a good idea, and it assists enormously when you actually want to get back up and running again. And you can see that in a number of airports. You mentioned airports. You can see that in a number of airports in countries where government has provided subsidies to retain essential workers. They haven't had the same level of problem to get back up to capacity levels as the pandemic has receded or subsided. So that would certainly be a lesson learned.
Thank you. Yes, both gentlemen over here.
Thank you. Good morning. Do you think that somewhere pandemic is also used politically for political purposes?
Well, I was saying earlier, I mean, I think the problem has been the approach of governments, some governments, not to see this as a health issue, but to see it as more of a political issue than a health issue. So that's been a problem throughout the pandemic. But it's got embroiled with politics rather than simple health and making sure that everybody's well. So yeah.
Good morning. You just said one lesson is encouraging countries that have encouraged airlines to keep workers via subsidies or assistance. That's worked, but how then do you account for the United States, where there's been consistent disruptions despite more than $50 billion given in payroll grants?
How do I account for
The disruptions? The U.S. is not really $50 billion plus in payroll grants, but lots of challenges with staffing and getting back up to capacity. They continue.
Oh, sure, yeah, okay. So, well, and I think the other thing to say about the whole sort of disruption piece is that we've seen a lot of differences by airport, by day of week, by hour. You'll see lots of pictures of airport disruption, but it certainly isn't the case that that's the majority experience. And I don't know how many people here experience severe delays on, making their way to Qatar and Doha. But our experience is, yes, there are some airports, some locations that are severely disrupted, but in general, the industry is coming out of this fairly capably. But there are some airports where it's really not working at all. But it's not a wide that we're aware of. It's not a widespread problem, but it is certainly a problem for those people that are affected.
Thank you. Yes, Bruno.
I will take another point of view. Would you consider that it could be a good idea to keep a certain amount of sanitary control at the borders, like, checking passenger temperature or asking passengers that go to wear a mask? Didn't we go from one extreme to another?
No, well, the thing is, are the measures effective? And the research says they're not. So we shouldn't be doing that. And the other thing that was noticeable in some countries during the pandemic was that measures were applied to air travel, and then they were not matched by similar measures applied to land borders or to railway. And this is where it becomes political. You need to be seen to be doing something, and therefore you introduce measures. Those measures can't be introduced into certain forms of travel, and therefore aviation is targeted because you can actually close air borders, whereas you can't necessarily close land borders. And so, no, I don't think that we've gone from one extreme to the other. I think we still need to concentrate on science, what's really effective, and not what's seen to be effective.
And backing that up, the evidence was that a plane was actually a safer indoor environment than virtually anywhere else because of the way the airflow is managed and the seating positions and things like that. So certainly an airplane should not be the first place to look for if you wanted to continue with some kind of measures like that. Any other questions? I don't see any other hands in the room. So in that case, I think we'll wrap it up there. But thank you very much, Conrad, for your time this morning, and thank you all for your questions.